In this segment, we're going to review the application of the Kool-Kit. Please understand that this is just for demonstration purposes only. The patient's rectal probe has not been placed. We are using a simulator for this demonstration and for this video. To apply the patient vest, we're going to use my two assistants so I can walk you through it. Dan and Allison are first going to roll the patient onto his side. If you were doing this in the emergency department, you'd roll the dirty sheets up underneath the patient, roll the patient vest behind the patient's back, with the opening ending up around the thoracic spine between T2 and T4. Roll the patient back on their other side and pull the patient vest through and any other dirty sheets that might be there. We're going to put the chest flaps over the patient and Velcro them down. We want to make sure while we're applying the patient vest that it completely covers the upper vasculature of the chest to make sure that we get in nice and snug into the clavicles and wrap nice and snug around the flanks. Once the patient vest has been applied, we're going to attach the hose and begin cooling. This will allow the vest to fill up and give a good fit to the patient vest. This will also give best body surface area contact. You want to make sure when we do all this that we leave all lead wires, leads, and defibrillator pads in place in case the patient needs them down the road. I'm going to pre-fill the head wrap. To pre-fill the head wrap, all I'm going to do is attach it to the hose, another hose of the Blanketrol III, and pre-fill. What this will do is give the best fit possible to the patient with the head wrap. I'm going to ask one of my assistants to help me and lift my patient's head to slide the head wrap underneath. Slide the head wrap down to approximately T4 and wrap the head wrap around the forehead. If you have a monitoring device on the forehead, leave it in place. Gently wrap around and Velcro down. Wrap around the neck, get a nice snug fit. It doesn't need to be tight. Make sure the ear is clear. If your patient has an intracranial pressure monitor or they have long hair, you can thread it out the top of the head wrap. If not, close the flaps for a nice snug fit. Once the head wrap is in place, we're going to apply the lower body blanket. To apply the lower body blanket, you're just going to place it between the hips and the knees with the hose coming out the side and tuck it in a little bit around the legs. You don't need to go crazy tucking it in, just give it a good custom fit. Once the blanket starts to fill up, cooling has fully been initiated, and your patient's temperature should start to decrease.